Let's start off with definition of asphyxia. What does asphyxia means? Asphyxia means pulselessness or simply the absence of pulse. Now, asphyxia has a certain triad. Now, mind it, this triad is not a specific triad of asphyxia. This triad can be present in another forms like in heart failure, etc. But asphyxia also has these three things. First is peripheral cyanosis. See, in this image, you can see the peripheries are blue and cyanosed. Why so? Because whenever there is asphyxia, or let's say there is hanging, then the oxygen here, the throat is broke right in hanging, so the oxygen is not received by the blood. If the blood does not have oxygen, then the hemoglobin will have carbon dioxide, so it will be carboxyhemoglobin, or carbon dioxide will be there in this hemoglobin. This will be of blue color, so due to lack of oxygen there is peripheral cyanosis in the asphyxia. We took the example of hanging over here. Second is petechial hemorrhages and visceral congestion. Now see, let's say in case it is a case of hanging, so in this case there will be compression over here, right? So whenever there is compression of over here, the blood from the blood vessels or the veins cannot be drained back to the heart due to this compression. So this will cause visceral congestion. Congestion means blood is over there and cannot be drained, so we have visceral congestion. Now whenever there is visceral congestion, so let's zoom a way over here. Now this vein is dilated due to blood, and the blood is not coming down, so there will be rupture of this vein, and this will cause what? Hemorrhages. So this is petechial hemorrhages and visceral congestion. What cause petechial hemorrhages? Visceral congestion. So we have pinpoint hemorrhages above the level of obstruction. As I told you, the obstruction is here and the hemorrhage is above because the blood is not coming down due to rupture of capillaries and venules. Now the site of this can be eyelids, mastoid, scalp, heart or pleural surface of the lung. These are site of the petechial hemorrhages. Now in this image you can see the spots over here in the eyes, over here, over here. These are all what? Petechial hemorrhages. Now if we combine two more things to this triad, we get a asphyxial quintlet or five things. Triad plus these two things. Second one is C, post-mortem fluidity of blood. What is this? After the death, whenever there is a sudden death due to hanging or asphyxia, there is fibrinolysis or breaking of the clot. So the clot is broken down in different parts of the body. This will lead to the fluidity of the blood. The blood has less clot, so it is more fluid, right? And the last one is right ventricle enlargement. See, this is a right ventricle and this is a left ventricle, so right ventricle is enlarged. Why? Because you know that the right ventricle pumps the blood into what? Lungs. So now in this asphyxia the lungs are congested, or there is a increased pressure in the lungs, so right ventricle is having difficulty in pumping the blood to these lungs. So due to that it has enlarged. So right ventricle first it was having difficulty pumping the blood out to the lungs, and due to that the lung pressure increased, so that's why the right ventricle has enlarged. So we have postmortem fluidity of blood and right ventricle enlargement. This combined with the triad. What was the triad? Triad was peripheral cyanosis, visceral congestion. Congestion was leading to petechial hemorrhages. This is asphyxial quintlet. Done. Now the type of asphyxia. See, in this lecture we are learning in deep about hanging. There are other two forms which are strangulation and suffocation. See, this is a hanging. This is manually with the hands. This is strangulation. It can also be done due to a wire, where another person holds a wire over the neck and it stretches it. That is strangulation. And the last one is suffocation. Now, hanging is a form where there is neck compression and the body suspension. So the weight that compresses the neck is the body weight itself, while in the strangulation there is no suspension but there is neck compression. In suffocation there is not even neck compression. In suffocation the oxygen is decreased in the environment, and that is leading to asphyxia, right? So we have hanging, strangulation and suffocation. Suffocation is therefore the purest form of asphyxia, where there is no neck compression or no body suspension. Now we are discussing about hanging in detail. Hanging, the weight of the body is causing the compression over here. So the constricting force is the weight of the body. We have the ligature encircling the neck and which causes the suspension of the body. This is hanging. Now, what are Prinsloo-Gordon artifact? Prinsloo-Gordon artifact or artifactual hemorrhages. For this, let's go into very basic. See, I am telling you what is bruise first. Let's say there is a there is a blunt weapon striking the skin, so it will have pressure on the skin, right? But it will not cut the skin because it is not a sharp weapon. So the blunt weapon is causing a pressure on the skin. Due to this, these blood vessels will rupture and there will be, let's say, this is extravasation of blood. This is extravasation of blood will come out because the vessels is ruptured due to this pressure. This is bruise. Now this happens when there is strangulation, when there is pressure like this inside the neck. At that time, due to pressure in the neck, there is extravasation of blood, so this is bruise. And this is a proof that there has been a strangulation or throttling like this. So after the person is dead, if we incise the neck and we find this bruising over here, that means that the person was throttled or strangulated before death. Now there is a catch here. Let's say that the person was not throttled or strangulated. Person died due to hanging and it was a suicidal death. So in this case, if I open the neck directly or cut the neck directly for autopsy findings, what I will see that whenever if I cut the neck directly, I will be cutting this blood vessel, right? And this blood vessel will leak the blood in this space. So this is also looking like bruise. So how will I say that this bruise is due to cutting, the doctor cutting the vessels, not due to antemortem strangulation? So how will we differentiate? For that, what we do is we do not we do not cut the neck first for the post-mortem examination. What we do is we first cut the cranial cavity. So when the cranial cavity is cut, the blood vessels are open from here, so the blood goes away like this. Cranial cavity is cut, blood vessels are cut in the cranium, and the blood is decompressed or come outside like this. Then we open thorax and abdomen. So the rest of the blood in the vessels is also out. Now there is no blood inside the neck vessels. Now we cut the neck for dissection. When we'll cut the neck, if we find some blood outside, then that is due to the bruise caused by manual strangulation or throttling, not due to vessels cutting before, because we have opened cranium, thorax and abdominal cavity, entire blood is gone out. Now there is no blood left to come out. If there is certain blood, then that blood was before the opening of the neck, right? So this is it. Now this was Prinsloo-Gordon artifact, that is hemorrhage in the neck during dissection. During the dissection, if we cut the vessel and there is blood inside the vessel, that will come out and it will look like bruise. So that is Prinsloo-Gordon artifact. Now to avoid this, what we do, we open the cranium first, decompress cerebral vessel. Decompression means blood is going out of the vessel, and then neck we open at the last. Done. We also incise jugular vein before neck examination to decompress it or to remove the blood from that vein so that it does not mimic the bruise. So these are the jugular veins that we need to incise. Now classification of hanging. See, this is the knot. Now if the knot is behind it, the occiput, then it is typical hanging. Other at any places it is called atypical hanging. Complete versus partial hanging. See, this is the complete hanging where the entire body weight is hanging and the no body part is touching the ground. In partial hanging, the body parts are touching the ground and the speed of death is faster in complete hanging while slower in partial hanging. Now this is the most important slide of hanging. See, let's just focus on this box. See, this is a trachea, this is esophagus, sorry, this is a vertebrae, this is esophagus and this is trachea, and this is a cut section of the neck from seen from above. Now in here we have this jugular vein and carotid artery. Now you can see that if this much is the neck structure, then this jugular vein is outside or more in the periphery while carotid artery is deep inside the neck, right? So if I want to, let's say if I want to throttle or compress these structures, then less force will be used to compress jugular vein, right? But the carotid artery which is deep, so more force is required. And the vertebrae and the trachea which are still deep, so even more force will be required for them. And this one is the vagus nerve. Now how much force is required to compress jugular vein is 2 kg, because it is right at the periphery. Just a 2 kg force will compress this vein, and the the blood flow will fail. Carotid artery 5 kg, 15 kg for trachea, and 30 kg for vertebra. So we have 2, 5, 30 and 15. Let's revise it once again. See, this was vertebrae, esophagus and trachea, jugular vein and carotid artery and the vagus nerve. Jugular vein we need 2 kg, carotid 5, 15 for trachea and 30 for the vertebrae. Right? So we learn how much force is required. Now if I give that much amount of force, then what will happen? See, okay. So if 2 kg of weight is given, then there will be jugular vein. Let's say first trachea. If the trachea is compressed by 15 kg of weight, there will be asphyxia or there will be pulselessness. Why? Because the gaseous transport will not happen. If the oxygen is not coming, then heart is not getting enough energy to pump blood to the entire body, and the blood will not be pumped, and there will be pulselessness or asphyxia in trachea. Now when the jugular vein is compressed, what is the function of vein? Vein brings heart to the body. So when, let's focus in this diagram. Whenever the vein is compressed, the blood will not come towards the heart, so blood will stagnate over here. So there's, that is called cerebral venous congestion, or blood is not coming to the heart but filling around the in that area, right? Now when carotid artery's function is to take the blood to the brain. When the artery is compressed, there will be cerebral anemia, or the brain will not get blood. When the vertebrae will compress, there will be simply be a vertebral bone fracture, because it is a bone. And when the vagus nerve will be compressed, there will be vagal inhibition of the heart will stop pumping, and there will be cardiac arrest when the vagus nerve is compressed. So once again we'll revise. Jugular vein is 2 kg, carotid is 5, trachea is 15, and vertebrae is 30. 15, 30, 2, 5. 2, 5, 15, 30. Okay. Now what is the most common cause of death in hanging, right? We know that jugular vein is the most superficial and easiest to compress, right? So we have cerebral venous congestion due to jugular vein and asphyxia due to trachea. So this is the most common cause of death in hanging. But in judicial hanging, there is a long drop, means, see the height from here ground. So when a person is hanged this much, there is sufficient force to break the vertebrae. That 30 kg force is given to break the vertebrae, and there is instant death in the cervical vertebrae fracture in judicial hanging. Now the ligature mark, simply the mark due to the ligature material used, and they cause what? Patterned abrasion. We learned this in the traumatology abrasion chapter. Initially it is pale, but eventually it turns dark brown because the abrasion changes its color. Now if there is a thin ligature mark, then it will go narrow and cut down the tissues, while if there is a broad ligature mark, then be a faint superficial mark, and this will be cutting the tissues because it is a very narrow ligature material. Now this is a conceptual. See, fixed note and slip note. What is a fixed note? Let's say this is a neck of a person, and this is a note. Now if this is a fixed note, then what will happen is the note will be like this, because it's a fixed note. So there will be a incomplete ligature mark. So it will have incomplete and oblique ligature mark. But if not, this knot is not fixed, then what will happen, that the knot will come like this at the neck, because the knot can move, right? So it will cover the entire neck. So we'll have complete transverse ligation mark. So if it is a slip knot, then the knot will slip and cover the entire neck, so we'll have complete transverse ligation mark, while in the fixed knot we have incomplete oblique ligation mark, and any ligation material can be used. Now this oblique incomplete mark is seen above thyroid cartilage, simply, right? the ligation material will be over here, not over here or down. So it will say, let's say this is a thyroid cartilage, then the mark will be above the thyroid cartilage. Done. So incomplete and oblique ligature mark above the thyroid cartilage. Now what is suspension peak? See, as I told you, there will be, let's say this is the neck and the ligature mark is incomplete and oblique. So here in this area there is a mark, but over here the mark is missing, right? So this is a V-shaped or suspension peak. This suspension peak or inverted V triangle shape is present only in hanging, but in strangulation we simply do what? We simply just throttle the neck and we pull it from this side. So there is no suspension peak in strangulation, but in hanging there is a suspension peak which is oblique ligature mark and inverted V shaped. Now, what are the autopsy finding in the hanging? See, first is glove and stocking glove and stocking pattern. What is this? See, whenever there is loss of blood circulation in the hanging after the person dies, there is loss of the heartbeat or heart is not beating. So now the blood is not going back to the heart, so the blood will pool in the peripheries. This is glove and stocking pattern. Now this doesn't mean that the person was hanged, right? It only means that the body was in vertical position after death. After any cause of death, if the body is in vertical position, we know heart is not beating, right? So every blood will pool down in the peripheries. So this is only, not only implied to hanging, body was in vertical position. So we have glove and stocking pattern. Now the face appearance. See, whenever there is partial hanging there is less force, right? So if the force is less, then only jugular vein is compressed and there is venous occlusion only, and the vein are occluded, we know the blood does not come back, so there is congestion over here. So the face appears like this or congested face. But if there is a complete hanging, then there is more force, so vein and artery both get compressed. So when artery is compressed, the blood doesn't go up also, so this head will appear pale. So due to arterial and venous occlusion, the dominating factor here is artery, because the blood is not going up, so artery, and here the appearance will be pale. Now the autopsy finding, now we are continuing them. Now what is the surest sign of hanging is dribbling of saliva. How? See, in this diagram you can see that this ligature mark is over here, so this ligature mark is compressing the salivary glands. So whenever the salivary gland is compressed, there is stimulation, and due to that stimulation there will be salivation, so there will be drooling of saliva from his mouth. Now whenever there is compression there is stimulation, and this stimulation causes salivation. Now all this thing will happen only if the person was alive during hanging, right? If the person was dead and then the person is kept in the hanging position, then out the dead person there is no stimulation and salivation. So the surest sign of antemortem hanging is what? Dribbling of saliva. Next sign is protrusion of tongue. See, over here in this diagram you can see this is the pharyngeal skeleton. Now whenever the neck is compressed, this tongue over here is protruded out due to lifting of the this pharyngeal skeleton is lifted up and the tongue is protruded out. So this is protrusion of tongue due to lifting of pharyngeal skeleton. This is also a sign of hanging. Next one is ipsilateral pupillary direction. See, let's just focus on the concept first. What is la fascia sympathetic? La fascia sympathetic means, let's say this one is the cervical nerves. Now whenever there is hanging, these nerves are compressed and these nerves are controlling the eye muscles. So whenever this cervical sympathetic trunk is compressed, the eye on the same side will, the pupil will dilate, there will be opening of eye. So we'll have ipsilateral eye opening and ipsilateral pupillary direction. Why? Because this cervical chain is compressed. Now just imagine if a person is dead and then he is subjected to hanging, then will this stimulation cause pupillary dilation? No, the person is already dead, so no activation of the nerve will cause this function. This will only happen if the person was alive at the time of hanging. So la fascia sympathetica and drooling of saliva both are sign of what? Antemortem hanging. In this image you can see that this cord is compressing the cervical trunk over here. So we'll have on the same side dilatation of pupil. See, this is constricted but this is dilated. So we have la fascia sympathetic, which is dilatation of pupil and opening of ipsilateral eye. Ipsilateral means same side where the pressure is applied. Second is drooling of saliva. And third is protrusion of tongue. Here you can see. So three, let's revise them: dribbling of saliva or drooling of saliva, protrusion of tongue, and la fascia sympathetic. Now, what are the internal findings? These are the external findings. Whenever you see a body that is right in front of you, those were the external findings. The saliva is dribbling, eyelid is like. Now, what are the internal findings? First internal finding is thyroid fracture, and we have greater cornua involved. See, this over here, superior cornu, this is the greater cornu, this will get fractured. Second one is hyoid bone fracture. See, this is more conceptual. Let's take two examples. First one is of hanging. In this hanging we will have, first let's learn the anatomy of hyoid bone. Hyoid bone has two cornua, this one and this one. So this is greater cornua and lesser cornua. So we have two of these protrusions. Now whenever there is hanging, there is anterior posterior force. This is the anterior part and this is the posterior part. So the force is like this. So whenever the force is like this, there will be, let's say this is the hyoid bone. Whenever there is anterior posterior force, there will be like this. So the this cornua will break outwards. So we'll have this hanging will have outward compression and both this cornua will be breaking outwards. So in abduction fracture or anterior posterior compression, both the ends are fractured and displaced outwards. But in side to side compression or throttling, let's say someone is throttling it like this with hand, then compression is side to side. So the one end is inside, another end goes outside. So we'll have one end is going inside while the other end will go like this outside. So we'll have in throttling or side to side compression, one end is inward, other end is outward. While in abduction fracture or anterior posterior compression, this happens in hanging. Anterior posterior compression, because the knot is back like this, so anterior posterior compression we have both the ends are displaced outwards. Now vertebral injuries in hangman fracture. See, what is hangman fracture? We know hangman fracture, there is the fracture of the cervical vertebrae. When the person is subjected to this much height and there is a fall, then there is more than 30 kgs of weight which will break the cervical vertebrae. Now let's look at this diagram. See, this is the C1 or the first vertebrae. Now the rope will be somewhere over here. So do you think this C1 will be broken? No, C1 is never broken in this hangman fracture. The vertebrae that are broken are C2, C3 and C4. So we'll have fracture at C2, C3, C4 but never C1 because it is above in the upper side. So it is never broken. Second, we have spondylolysis of C4 over C3. See, that is C4 is splitting and it is sliding over C3. That is spondylolisthesis of C4 over C3. So this happens. Where does this happen? In judicial hanging, when is hanging is from a height. So if it's from a height, then more force is there which will exceed that 30 kg and cause the hangman fracture. These are the types of hangman fracture. You don't need to see the types, you just need to see that this vertebrae is breaking, and due to this breaking of vertebrae the spinal cord will be affected and there will be instant death. Now what is Simon's hemorrhage? See, let's first look at this diagram. This is the lumbar region, so everything is happening at the lumbar region. In the lumbar region there is an anterior longitudinal ligament. So whenever there is prolonged hanging, there will be pressure at this anterior longitudinal ligament. So the blood vessel which are behind this anterior longitudinal ligament, they will rupture and this will cause hemorrhage over here, let's say in this intervertebral disc. So we have strip like hemorrhages in the intervertebral disc between lumbar vertebrae, and all this is happening behind the anterior longitudinal ligament. And these hemorrhages, these spots are called Simon's hemorrhages, right? So where the location exactly from these three diagrams we can find out. So we have Simon's hemorrhages. Now carotid artery injury, what is this? See, let's see, this is the carotid artery. Whenever there is hanging, there is a intense pressure over here. So this pressure will cause tear in the innermost layer. The innermost layer is the tunica intima. outer is adventitia and media, but the tear is in the innermost layer. So whenever there is tear or injury, there will be bruising, right? So it is associated with bruising. Now this tear is called amusant sign. This tear over here is called amusant sign, and it is seen in judicial hanging as we are discussing. But why this is a sign of antemortem sign? Why this is sign? Can anyone say? See, this tear is a bruise, right? It's a bruise. Now, can a bruise happen in a dead person? No. For bruise to occur, the heart should pump the blood. The blood should come here in the carotid artery, and that blood will cause bruise. That bruise is a sign that the person was alive at the time of this carotid compression, whenever the tear happened, right? So this amusant sign is a sign of antemortem injury or the antemortem hanging. Now, see, most common method of suicide is hanging, then followed by poisoning, and the fatal period is 3 to 5 minutes, and it is a painless death, but requires a lot of courage, right? Now, homicidal hanging. It is done judicially, and lynching. Lynching means it is extrajudicially, where a group of people gather together in public and they hang someone outside the laws, right? In judicial hanging, in judicially, hanging is used to kill people. It is practiced in India. Now, the hangman knot is ideally at submental position, but in India it is below the ear at the angle of mandible. This is the angle of mandible that it is used. Ideally, it should be at the submental position. Now, the last topic of today is autoerotic asphyxia. What is this? Let's start from the mechanism. Here, see, in this image, you can see the person is naked and the neck is compressed like this. So, how is he naked and this compression everything? Let's first start in the mechanism. See, whenever there is compression over here, the blood flow decreases to the brain, right? The carotid artery blood flow decreases to the brain, so this will cause cerebral ischemia, and this cerebral ischemia is causing the erotic hallucination and the orgasm. So for this orgasm, the person is performing this act, so he will tie the knot around here, and due to this he will get orgasm. So now, where is the problem? The problem is whenever this carotid artery is compressed, the blood flow decreases to the brain, right? So the person can fall unconscious. If the person falls unconscious and does not release this, then he can die. So the failure of release leads to death. If it is released by the person, then it is normal, nothing happens. But if the person falls unconscious and he fails to release it, then he dies. So this is and the dead body is found over here naked with this hanging stuff. So this is what autoerotic asphyxia. It is commonly seen in male perverts, and it is done for sexual gratification. It is also known as hypoxiphilia, and it is a form of masochism. Now here the person can also be seen. This is transvestism. What is transvestism? Transvestism means the person is wearing clothes of a opposite gender. So this kind of activity is also seen over here. So in the crime scene, we will find what? We'll find a naked body, we might find a pornographic material, but no suicidal note, because there was no intention of suicide. The intention was of getting orgasm or sexual gratification.